His Interior Ministry now says it too has come under a cyber attack. We're going to have more on this breaking story as it happens. In the meantime, the Obamacare death spiral. Aetna is the nation's third largest insurer. They are announcing they're withdrawing completely from the Obamacare marketplace in 2018, leaving their last two exchanges in Delaware and Nebraska. Here now is Zeke Emanuel, Obamacare architect, Fox News contributor. What is the solution to this problem?
Well, we've all known what the solution is. First, we should be clear that Aetna had a very tiny footprint left to withdraw from. 12,000 people in Delaware and a few thousand in Nebraska.
So they'd already given up.
And in fact, its withdrawal hardly affected its stock price. Its stock price compared to Monday was up less than 2 points.
Because everybody saw this coming.
About 1%.
Yeah.
The three things you really need to do: enforce the mandate. These cost-sharing subsidies that help families under $60,000 pay the deductible, and reinsurance risk corridors for insurers. We know what they are. The administration and the Republican Congress have refused to actually make these things final.
Well, I mean, enforcing the mandate is the idea of that there are young, healthy people who do not see a benefit in buying the insurance because you're paying more for your premiums than you're using if you just paid for your medical care out of pocket. So you're forcing young people to pay more than they're using and subsidize older people. What's wrong with the idea of creating risk pools where you would
You
put
remember
in
what insurance is.
Insurance,
I buy homeowners insurance or I buy fire insurance, so I'll pay a premium now on the off chance that something bad will happen. Health insurance turns out to be exactly the same. I buy insurance as a young person, not because I hope I'm going to use it, because in fact I hope I don't use it.
But there's a very big difference.
If I have an accident.
There's a very big difference. You don't buy health insurance for a tornado if you don't live in an area, homeowner insurance if you don't live in an area where it happens a lot. And with health insurance, young people are saying it is so rare, the risk-benefit analysis, it is so rare that I might get sick, I'm not going to pay all this money in the meantime. In any case, that's a little bit beside the point. I wanted to ask you what you think is wrong with the idea of creating these large risk pools for the people who use a lot of insurance. I mean, this is a key centerpiece of the Republican plan, directing federal funds at that rather than the distortion of trying to get the young people to pay, because we haven't been able to force people to do what's against their own economic interest. It's like socialism, it doesn't work. But if you direct the government funds at these pools of people who do use a lot of health insurance, what's wrong with that idea?
Let's just talk about those high-risk pools.
Yeah.
Let's just talk about those high-risk pools for a second. First of all, in the Republican bill, they have about $138 billion. You know, Fred Upton pounded his chest about getting $8 billion more dollars, $138 billion. So
you're saying it's not enough?
Every analysis says that's inadequate. Even Republicans at the American Enterprise Institute say you need at least $200 billion, so it's inadequately funded. That's the first thing. Second is, every economic analysis shows you that it's a very inefficient way of providing health insurance.
How do you figure?
Give subsidies to these people of more than $10,000 to buy insurance. That is terribly inefficient. And the estimates of the number of people
but why is it inefficient if you direct the money at the people who use them? Zeke, why is it inefficient if you direct the money at the people who are using it to pay for that care? What's inefficient about that?
Well, because we know that 5% of the population uses 50% of the health care costs. So you actually end up subsidizing a huge amount of health care. Whereas if you spread it out, if you get everyone insurance, you're spreading out those payments across the entire population. It's a much smaller amount per person. It's a much more efficient system.
It didn't work. If you take the government's money and you just focus it at the area where people are spending money. I mean, you said it, and it's so true. 5% of the people are doing 50% of the cost. Let's direct all of our subsidy at those people.
You know what 50% of the cost? If you had to pay for that 50% of the cost for these people, you're now talking about hundreds of billions of dollars. That is, by definition, inefficient way to deliver it.
I mean, I'm with you. These people are using health care. Someone's got to pay for it. Apparently, we're starting from the premise that the people using the health care aren't going to pay for it for whatever reason. So if it's not going to be the sick people,
for the simple reason,
and it's not going to be the government, who's it going to be?
Let's just explain. If you're really sick, you're a woman who ends up, unfortunately, getting breast cancer, you're talking about in the first 6 months an $80,000 bill. You're going to pay for that, where the median income in America is $56,000.
I'm not disputing that person can't pay for it. I'm saying
that's why we have
who's going to pay for it?
Let me just finish. That's why we have insurance. And the best way of providing insurance to everyone is literally to provide it for everyone. That spreads the cost over the entire population.
But you see that hasn't worked, right? That people are too smart for that?
I've always paired that insurance argument with the second argument, which is we really need to focus on cost control, getting our unnecessary care out of the system and inefficiently delivered care out of the system. And Speaker Ryan's bill contains absolutely zero elements of cost control for the system.
How does it make
nothing about long-term cost control?
What creates
you want to get rid of high prices in health care?
So
you
what
need
would
cost control.
Hang on one
and
second.
Speaker Ryan did nothing about that.
What kind of cost controls are you talking about? Because originally you were talking about bending the cost curve, which is not a real thing and doesn't exist. What is it that you're saying that would control costs at this point? What would you like to see?
Wait. Bending the cost curve does exist. It's called the rate of inflation year on and year out. And through the Affordable Care Act, as well as other things, the cost curve did bend for 5 years after 2010. That's just a fact.
Okay.
And the
I disagree with that, but let's move on to the idea.
We need to pay doctors, pay hospitals differently. We need to pay them.
What's differently?
So
How do you pay them differently? What does that mean? More?
Unnecessary care. It's
what does
in their
that mean?
interest to get rid of inefficiently delivered care.
How do you pay them differently?
I hear you. Everybody. Brand name drugs and generics that they prescribe.
Zeke, you got to answer my question, sir. What do you mean pay them differently? What does that mean? Are we paying them with leaves off a tree?
So
what is that?
I'll give you a good example. Right now, if you need a hip replacement, right, we pay the surgeon, we pay the anesthesiologist, we pay the hospital, we pay for the implant, we then pay for the care after the hospital, the physical therapy if you go to a facility. Rather than paying each of those separately where people don't have an interest in collaborating and trying to reduce costs, we pay one payment. We're going to say we're paying $22,000 for that hip replacement, and then people suddenly figure out, oh, they can save money, and if they save money under that $22,000, they actually make more money for doing that, and through efficiency actually makes them more money. That's changing how we pay them. No longer fee-for-service, what's called bundle payment, and they actually realize some of that. They bargain down the price of the implant. They use the intensive care unit less. They use post-hospital facilities less. It actually turns out to be very efficient. They actually look at their surgical site infections and try to prevent any infections because those are expensive to them. That's what I mean by paying them differently. We have very good data.
We got to go. We appreciate your time. Thank you.
We got to